Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Pharmacy Medicine and today we'll discuss about unnatural sexual offences. In that we'll discuss mainly about sodomy. Coming to what is unnatural sexual offence. So any wanted sexual intercourse against the order of nature with any man, woman or animal is considered as unnatural sexual offences. This comes under section 377 of IPC. So it is against the order of nature, which mainly where sexual intercourse is between man and female using the person's genitalia against the woman's genitalia. But here unnatural is against that opposite to the other way other than that is considered as unnatural sexual offences. These offences are punishable with imprisonment of life up to 10 years also with fine. This all comes under 377 IPC. So unnatural sexual offences include sodomy, tribalism, buccal coitus, oral coitus, or bestiality. In today's video, we'll discuss mainly about sodomy. So sodomy is defined as anal intercourse performed by a male with another male or female who may be adult child or adult with or without consent or by force. So here mainly the person have sexual intercourse in the anal region. So other than natural order of vaginal intercourse, it is a anal intercourse. It was usually practiced in a town called Sodom. So that's why this name is called as sodomy. It is also sometimes called as buggery, and in some Greek in golden age of Greek, it was followed, hence it was also referred as Greek love. Some definitions: active agent in sodomy is a sodomist male who performs the anal intercourse actively. That means he uses his genital his penis to actively perform sexual intercourse. Passive agent in sodomy is a sodomist. He may be he or she, it may be a male or female who offers the anus and plays a passive role. Next, pederasty is an adult person who is performing sodomy act involving a male or a female child as his passive agent. So, if a child is used in the case of as a passive agent, it is considered a pederasty. Petamite is a child who plays as a passive role in sodomy. Then gerontophilia is a old male or female who act as a passive agent. So in gerontophilia means he may be a male or she may be a female, old male or female who act as a passive agent offering a NS for intercourse. Now coming to examination of a passive agent, general process how examination has to be processed. So mainly in case of sodomy, if it was against the consent, these cases may come across as a sexual offense cases. It has to examined by a medical practitioner. First of all, it has to this written authorization should be present by an investigation officer. It may be authorization by a magistrate or by police officer who is above superintendent. Then general information like age, name, age, sex, address, occupation, time, date, place of examination should be noted. Then identification mark should be noted down. Then consent has to be taken. If the person is less than 18 years, then consent of the guardian has to be taken down. In case in examination of accused, 53(1) CRPC can be applied where a person can be examined without the consent. Then inquiry should be made about his bowel habits, mainly which includes any condition of constipation, use of laxatives, any meta suppositories, in surgical procedure, also instrumentation of the bowel, previous acts of anal intercourse, then frequency or last act of anal intercourse. These all things has to be first noted down. So this will be helpful for examination as well as collection of samples to know whether if there is a constipation is there, what should be present. In case of constipation, many times the fecal matter will be present in the rectum, which can present in the which can be excreted and it can be seen in the person who is accused. It may be deposited, so it will be helpful. Use of laxatives or any matter of suppositories may eliminate the seminal samples if the intercourse was there. Then if the person is habitual and intercourse, then the findings will be less, the injuries will be very less. Then brief history will be taken, which includes date and time and place of alleged act, where it was kind of done. Place will be helpful to examine the scene of crime for presence of any foreign hairs, then presence of any hairs that will be useful. Then position in which sodomy was performed. This again is helpful again to know where the swabs should be collected, like semen swabs or any type of saliva stamps should be collected. Details of struggle resistance is again noted. If he or she tried to bite or make him injury, what injuries he has caused on the accused, what injuries were there, that has to be noted down. If there is any use of any lubricants, if any lubricant is used, what type of lubricant was used, whether it is helpful, and if any lubricant was left on the scene of crime will be noted down. Then degree of penetration, whether it was complete penetration or just it was a margin penetration. Again, it will be helpful to know how whether the swab can be present on the margins or in the painted deep. Whether there was any ejaculation during the act or not. Ejaculation if present, then semen can be easily obtained, and which will prove that there was an act of sodomy was present. Then whether pain was experienced either at the time of incident or subsequently. So this indicates whether it was consenting, not consenting. If there was no pain, then the chances that the person may not be have conducted an intercourse, or it may be that he has done slowly and passively, so that rectum may be complete, anus may be completely dilated, which reduces the presence of any injuries. Whether there was any bleeding present. So bleeding indicates that it was very forceful, and presence of bleeding indicates that it was forceful, as well as that injuries may be caused, which will be helpful for further case identification. Whether there was defecation of the alleged act. If the defecation was done, then again semen samples will be lost and findings will be lost. Change of clothes, whether they change the clothes or not, whether they bathed or washed the anal area. Again, if they have done that, then the findings will be lost. This history has to be collected and noted down. Next, we examine the clothes. Again, the examination of clothes is done similar to that of an examination of survivor of a rape case. All the cloth material shows to be removed one by one. Presence of foreign material should be noted down. Especially crotch area of underwear should be noted down for examination of presence of blood, semen, or fecal stains. General injuries should be noted down, like scratches, especially on the back side of buttocks should be looked for. Then examination carried out in the presence, it should be usually carried out in the third person presence in the lateral position, or better in the prone or in knee elbow position. This is an image of a knee elbow position. This position is preferable for anal examination because it gives visualization of anus easily. Then swab must be taken from the inner verse and the skin of the perineum. Row rectum and anal canal must be inspected for injuries or mucosa abnormality. Sometimes proctoscope can also be used for better visualization of the anus and rectum. Then local examination of anus should be done. Anal muscles is usually after sodomy becomes edematous, abraded and bruised with losing of blood up to 24 hours. Anal muscle may be found dilated, irritable and tender to touch because of intercourse. Digital examination must show loss of elasticity and tone. Hematoma is frequently seen either as a diffuse swelling or as localized swelling near the anal region. Then linear abrasions varying in numbers may be present, extending from the anal margins. Usually near them from it extend from margins towards the rectum. If sudden bias is used, there may be triangular bruised area may be present posterior part of anus with the base externally at the anus. So usually the any injuries in the anal will be have a like bruise or laceration or fissures will be have a triangular region where base will be near the anus, near the margins of the external anus, and tip will be near the rectum. So that type of injuries will be typically present. Tearing of sphincter ani is rare in adults and older children, but can occur in the younger children because of smaller anus. There may be sometimes inner prolapse may also be occur. Lesions are more marked in children because of greater disproportion of the size between the orifice of the victim and the penis of the accused. More injuries will be present, tearing off will be present. Sometimes there may be prolapse may also be occur. Anal fissures, which are longitudinal fissures, may be seen extend from the anal canal at the mucocutaneous junction. Fissures are produced due to overstretching of the skin. This will be seen. So this is the image of anus. Sphincters will be relaxed. There will be small fissures or larger fissures with like a wedge-shaped injuries will be typically seen. Other signs will be like blood stains around the anus, on perineum and clothes will be present. Fecal matter may be found around the anus. There may be pain during walking, defecation, and anal examination. Signs of struggle of bruises and abrasions may be found on the other parts of the body, like on the face, body, chest, or back will be present. For 2 to 3 days, there may be pain, congestion, and oozing of blood-stained fluid from the anus will be seen. Diagnosis of sodomy, only proof of sodomy is the presence of semen in anus. So if the semen is present, that will be indicate that there was sodomy was there. Any lubricant matter, seminal fluid, or venereal infection found at the anus or recorded from the swabs and rectum is strong evidence of the crime. Opinion has to cause whether there was sodomy or not is mainly has to be answered correctly. So should be reserved. Mainly the cause of dilatation of the anus should be guarded, and it should only be stated that it is consistent with the entry of penis. So if there is a dilatation of anus is present, then we can only opine that there is a signs of anal penetration is present. Other than that, we can't opine whether there was complete. It was sort of it was penetration penetration was there or not. And if semen is present, then only you can confirm it that there was sodomy was confirmedly present. Now coming to examination of habitual passive agent. So previously I mentioned about examination of the passive agent. In habitual passive agent, they are frequently prone in the habitual passive sodomy. These are usually seen as male prostitutes who offer their anus for asexual intercourse. In them, the signs include that anal hair will be shaved, the skin above the anus becomes smooth and thickened because of repeated intercourse, and then muscles of the anus loses its tone, does not contract so readily when the skin is around it is pinched. Slight depression of buttocks towards the anus due to absorption of fat. So because of frequent intercourse, the fat near the buttocks will be reduced. Then there will be dilatation and laxity of anus, and the epithelialization of the wrinkled mucosa may be seen. There may be anal fissures, scars, etc. There may be signs of venereal disease will be also present. There may be absence of wrinkles in the near anal mucosa. Wrinkles will be absent. Piles and fissures are very common in the old sodomist. Then the butter traction test can be done to know whether it is habitual or not. In habitual persons, when a thumb is placed on the each side of the anus and lateral traction is applied, the normal person they are accustomed who are not accustomed to sodomy, there will be reflex contraction of the sphincter. So in the traction, when the traction is given to the buttocks, the sphincters contracts reflexly. So it is seen in the normally. In habitual sodomist, a complete relaxation of sphincter occurs with dilatation of the opening, which may be 4 to 5 cm in diameter, through which rectum can be seen. But in case of habitual person, when you try to retract it, the instead of contracting the sphincter will relax completely up to 4 to 5 centimeters, which indicates that there is the person may be a habitual sodomist. Then specimens to be collected in case of sodomy. First is the blood, urine, similar to that. Again, blood will be helpful for the blood grouping. Urine mainly to see whether the person was intoxicated or not. Head hairs, pubic hairs, any loose hairs found on the body, fibers from anyone on the body should be collected. Again, head hairs, again loose hairs which found of accused may be found. Pubic hairs, again persons accused as well as the survivor may be present. Then swabs from many soiled areas of the skin. So if the person has had sexual anal intercourse, then there may be fecal matter attached to the penis and it may be distributed on the throughout the body. So any part of the body which is soiled by fecus has to be swabbed. Swab from the anal, perineal, perianal and rectum has to be taken if necessary with aid of proctoscope. Rectal washing with sterile saline can also be done. Then nail scraping is done to collected and sent for FSL. These are done to know whether there was presence of any semen or not, and presence of any no, cells which are other than the person's own. Then opinion, it should be based on presence of semen or seminal stains and in and around the anus. Then there was a soiling of anal regions with lubricants, smearing of clothes with semen, blood and lubricants or anal material, injuries in and around the anus, foreign hairs, changes in the general anatomy of anal opening and surrounding area. So based on all this, the opinion has to be given. Non-specific findings such as erythema, perianal abrasions, and peripigmentary venous changes along with the history may be suggestive of alleged contact. If any dilatation of anus is present, opinion should be given that it is consistent with the entry penis. So that is the only thing opinion can be given, that if there is a dilatation of anus and if it is present, and then opinion can be given that there is consistent with the entry of penis. Presence of semen, feces, or soft paraffin or pubic hair on clothes is almost diagnostic of sodomy. So presence of semen or fecus indicates that sodomy was completely done, and just dilatation of penis indicates that there was entry of penis was done. The only absolute proof of sodomy is the presence of semen in the anus. Now coming to examination of active agent in case of sodomy. Again, in active agent, the only evidence commonly found is the peculiar smell of anal glands transferred to the penis and traces of fecal matter and lubricant on the organ. So if he has completely penetrated the anus, then anal fecal matter will be present on the penis, as well as the smell of anal glands will be present. Sometimes there will be abrasion of prepuce, glans penis, killing of frenum, and swelling of redness of the penis will be present, because he may try to forcefully enter the anus, or because of contraction of sphincters, there may be injuries on the penis. There may be fecal swelling, blood, and foreign hairs are likely to be found in the around the coronal sulcus. That is sulcus. Because of the depression near the coronal sulcus, chances is there that some fecal matter may be deposited, which can be swabbed for examination. The urethral swab may be show fecal material and organisms similar to those found in the anal verge. Again, when the urethral swab is taken, thus the bacteria which are usually present in the inner regions will be found in the organisms will be found in the urethral regions. Then blood and seminal stains will be present, has to be taken. In the presence of another disease, if signs of another disease is there, should be noted down. If any marks of violence on the body is present, that is correlating with the history given by the accused, history given by the victim has to be seen. Then clothes may show similar stains or mixture of semen and feces. In habitual sodomist, penis may be elongated and constricted at some distance from the glans with twisted aorta. This is many times seen in the habitual person who is constantly engaged in anal intercourse. So in them, the penis may be get elongated and constricted at one point, which at the glans with twisted urethra may be seen. Specimens which has to be collected in active agents, clothing, swabs from the glands, urethral discharge, blood, pubic hair, if present, nail scrapings, urine samples has to be collected. Again, these samples will be cross-referenced with that of victim for identification of the accused. Now coming to medical importance of sodomy. Sodomy between two adult males or a male and female in private with consent is not an offense. So previously it was considered as an offense. In recent judgment, now it has not made an offense if there is a consenting male or female is there. If the consent is free, voluntary, it is not an offense, and the consent should be free, voluntary nature and devoid of any duress or coercion. Anal sex has been recognized as a sexual choice of an individual rather than a mental abnormality. And only the active agent is punished when the offense is committed without the consent. So, if it is done without the consent, it is regarded as it is punishable. But it is now, if it is consenting, if it is consented, then it is not considered as, which is not considered as punishable. The crime is usually the sodomy was frequently among in sailors, prisoners, or in hostels or military barracks, where they are thrown together for longer periods. False charges may be made for blackmail, and men may be tricked in homosexuality relationship by men disguising as a woman. In India, there is a class of male prostitutes called as eunuchs. Among them, there are two groups called as hijras and jananas. In hijras, from childhood, their genitalia is been severed or cut up, and as they grow, they develop as feminine characteristics. In Janana, the genitalia will be intact, but they live as a female and act as a male prostitutes. And they are usually all these groups act as a passive agents in sodomy. Marriage contract gives a implied consent for sexual intercourse per vaginum and not per annum. So according to rule, sexual intercourse has to be natural, that is vaginum, but it doesn't give permit for anal intercourse. So based on section 13 of Indian Marriage Act, the woman can get a divorce if the husband does the sexual intercourse, has a forceful sexual intercourse, forceful anal intercourse. These are my references. Thank you.